It's watching us.
Yeah. Okay, we're all set.
Well, I hope you all had a happy Thanksgiving.
Ate too much
Yeah.
like usual.
I know. Well, and it was late this year, so it's like, we only have 4 weeks left of this year. How did that happen? So it's going fast, going fast. We will be getting a new snapshot out for November pretty soon. So I'll send that on. And I know I've sent an electronic version of the chip, but I didn't know if you wanted a paper copy. I did send an email a couple weeks ago, I think, asking if we could get it on the agenda for me to present this in an afternoon meeting. And I also made a request, I copied Steve on it, whether or not we could adopt the chip as a resolution. And kind of my logic behind that is that we have a lot of other county entities that are partners or leads on this. So just giving this some validity, a little bit of weight. So anyway, I don't know if that's something you've thought about or discussed, if you've seen my email, but I was just hoping that maybe that we could look at that for December or early January to kind of talk about this. Let me talk about the CHA and the CHIP and what we planned and what we're doing. We did meet a couple of weeks ago as a core group. So the same core group I've been working with. So that's Barb, Drew, Dawson, Jim Murphy, LaDana, Lindsay, and myself to talk about implementation. So the goals in here will be for the next couple of years, 3 years, will end December of 2027. So the two priorities are mental health and behavioral health, and then healthcare and quality. So access to healthcare and quality. So those are the things we're working on. I've already met with a few of those lead people on some of those strategies. Like I met with Rin with Community Integrated Health in Whitehall last week. I met with Drew on some of the city folks last week, 2 weeks ago, probably talking about some EMS stuff. So we're starting to roll with doing some implementation. We're not going to just let grass grow. We're going to keep moving on this. So anyway, I one of the things that they ask us to do is to present it to the community. So one way would be to be able to present it in a public meeting, like a commission meeting. Do you have any questions about it, or what?
What's your point of contact in Whitehall?
I have several, but one of our strategies is to keep and expand community integrated health.
Right.
And one of the challenges with that, obviously, is funding. The other challenge is EMS and the rest of the county, because Whitehall's EMS is much more organized in advance than we have in other places. So Rin, what's Rin's last name? She's their director for the community integrated health out there. So she and I met. She actually has been really excited, not only with the current job, but the past ones, because she's collecting a lot of data, because she is trying to get funding for that. So she and I talked about, how to kind of move forward with that. She'll be one of the lead people on that strategy for that. And then Drew is one of the lead people on our EMS strategies, which is our third objective in here, and under healthcare access. So he and I have met too. So we're just trying to start moving some pieces. Barb Ryder with prevention, Aaron Ritchie with school nursing, the mental health LAC. I'll have some pieces in this, and I talked with the mental health LAC at our last meeting about which of those strategies involve them, ask them to kind of be looking at that, so that at our meeting in December, we can kind of look at who on that committee wants to be part of those different goals and maybe even lead them, because my name's on too many of them to lead. So, so that's what we're doing with that. It's been a good project. One of the things we're doing with the Pathways program, so it's not accreditation, but it's kind of a pathway to recognition, and I've sent you that email about all of that, but that program's starting in January. And so we have to have a completed completed CHIP, and a completed strategic plan to do that program. So our next step with that is doing a strategic plan. So in January, the state's going to come and help us, their Systems Improvement Office, start working on a strategic plan. So we'll be looking at some of what we're doing with this to create.
When are they gonna do that?
In
January?
January. So they'll work with my staff and I first. We will develop mission, vision, goals, those sorts of things. And then we'll present it to our health officer and board for feedback and, for their input and to ask for their support in it. And then we come back to the staff to finalize the plan. So that's kind of the process with that.
When do you get community input on vision and
When do I get what?
community input?
I don't know on that. I don't know. That's just what I was
Well,
told.
we come up with a vision and
Right.
mission, and we should let the community
Be part of that.
have a voice in that somehow,
Well, let me take that back and talk
some
to,
ownership. Once you have
Yeah.
an
Yeah.
outline, maybe then you go to them and ask somehow. Maybe, I don't know
so let me reach out to my point of contact there about that.
what the way is of doing that. Otherwise, it's just our plan,
Yeah.
which is okay. It's probably the way it'll be anyway.
We got some pretty good community input usually on the health stuff.
Well, and part of, like I've told you, the reason that I want to do this program, which is 2 years, and it's a decent commitment from our department, but I'll be retiring within a few years. And so that really helps put the department in a place to be in a good place to move forward and have a new leader. So I'd like to be able to do that before I leave. Another thing that's coming up for us, Doug is putting together an ICS 300 training. Molly, Jesse, Tana, and I have all done it in the past. Aaron has not. But all of us who've done it, it's been a while ago. So 2 things: we'd like to support Doug in this training he's doing. He's asking that we get some local people. But also it would be beneficial for our department to do this. It's a 3-day training in February. We don't have all the logistics yet, but if we were all to do that, we'd need to close our office for 3 days. So I'm
3 days.
just kind of putting it out there to you to think about. If you don't want us to do that, then, one of us would stay behind, but it would actually be a good experience for all of us to do it together. Especially considering what we went through with the pandemic and having to use, those ICS strategies. But anyway, I wanted to give you a little bit of notice on that's coming up in February. I think he had the 12th through the 14th, which is a Wednesday, Thursday, Friday, and the last week of the month, which was a Monday, Tuesday, Wednesday, as options. Those were Doug's options. So we don't have a registration link yet. So I think our preference would be to do that Wednesday, Thursday, Friday. It would only be a half day of closing Clancy. But anyway, I'm just letting you know and asking you to consider that, and have your permission to do that. If not, then we'll find one of us to stay back and keep the office open.
I don't see a problem with it as long as you guys are looking at your messages and making sure.
Right, getting
anybody
good
that's
messaging
needing
out.
something could get a
Right.
hold of you.
Okay.
Yeah.
Well, I'll keep you updated as we get more information, but I wanted to have a little notice on that. With crisis diversion at 11, I'm meeting with Butte Silver Bowl. The grant has dropped. We still are kind of working on things. One of the requests I have made is that we get an MOU in writing so we can start looking at it. So they're supposed to give us a draft of that today.
And a copy of the grant.
We haven't seen that yet.
That'd be nice too. We're in it. It'd be nice to get a copy of
Yeah.
that. And a copy of our data if they have it on.
I did get that, Bob.
Oh, great.
You're
great,
gonna
great,
be
great.
so happy. I'm gonna pass that on to you.
Does it look like there's some data there?
There is some good data
Oh, good,
there.
good, good.
So I met with JG Research.
This is on,
Mental health.
mental health phone calls,
Uh-huh.
crisis calls, yeah.
I met with Brandon from JG Research and said, one of the things we're lacking is data. What do we need to do to get that? So he said, well, let me see what we can do. So they put together, he said, we can usually generate it 6 months at a time. So they put together the past 6 months. And then I think I got all of 2023. So I think I've got a year and a half of data.
Some comparative data there.
So I will pass that on. I thought after this meeting that I would try to do an email and kind of loop you guys in. I need Tom, I need Steve, I need all of these people to kind of be involved, because our next step is to bring everybody to the table to do a mapping event, to kind of do some strategic planning for where we're going and what we're doing. And I talked to Katie Loveland, who is a consultant who's working on this, and she said that generally what that looks like is a full day, at least 6 hours, where we bring all those folks to the table, and then we'd come back for another couple hours to kind of, look at what we decided after she had, processed it all. So that's also going to need commission backup to get, the other entities to the table and say, we need to do this, and, this is when we're going to do it. So after I get that information and send out that email, and maybe I'll put in that a request that we look for a date for mapping. When I talked to Katie last, she said that her January and February still had some good dates that she could come out and do that. So we'd probably just schedule the volunteer hall and, have a day where we sat down and looked at what we can do. So we'd need EMS at the table, we'd need sheriff, we'd need the county attorney, schools, those sorts of people, mental health, LIC.
Who pays Katie?
I'm hoping it comes out of this grant. The mental health LAC said that they would do it. It's about a $5,000
Yeah, we put
project.
5,000 away.
And we had said we would pay for it, but we really haven't pulled the trigger, because if this grant will pay for it, let's let them pay for it,
Absolutely.
So that's going on. Now, the other thing I had was kind of a question. I got an email from the insurance from Boulder administration asking me to talk to, what is it, script sourcing, because one of my husband's medications was eligible to go through this program.
Right.
So I did make that appointment, and I talked to that person from that advocacy person, and she honestly didn't answer a lot of my questions. So one of the questions I had was, so I've got a zero copay on this, but where is this revenue going and who is paying for this? And she didn't know. I said, where are these prescriptions coming from? She said, Canada. So anyway, I went to get this filled, and Josh happened to be there. And so I said, Josh, what do you know about this? Because honestly, Kelly's got quite a few medications, and Josh has done an excellent job of getting us reduced prices on almost everything, because Kelly has chronic conditions. A lot of times those prescriptions can come in at a zero copay, and he's done a great job to help us with that. So he was kind of hot about this because, and I didn't understand all of what he was saying, but it sounds like that revenue isn't coming back to us as the county. I'm kind of concerned about it, because one of the things we're trying to do is to have access to healthcare and quality healthcare locally. And so if we're outsourcing things, then how does that support our local healthcare people? I also have been having some health issues that I've been working with the insurance on. I've got some joint things going on. And so we're looking at what next steps are for me, because I've been doing the chiropractics and all of those sorts of things. Still needing some more relief. So surgery may be an option. So what they're telling me is that if I have surgery, that I have to go to Billings to have it. I don't agree with that either. I just don't agree I mean, we don't have a hospital here, but Butte and Helena are local, and the surgeon that I've chosen is, is reputable. And I just feel like, as a patient and as a nurse, sending somebody with a hip replacement to have to travel, I mean, there's no good pre-op, there's no good post-op. What if I have complications? I'm old, I could, I mean, I just don't know what we're gaining by doing that. So I know that there's always a dollar sign with this.
That's why we're doing that.
But I think that we do have to look at what kind of quality of care we're giving to our people. And
I think that's a great point.
what?
That's a great point.
So I don't know, where all of your poll is in that, but I did want to voice my opinion on it. In fact, if it comes down to a surgery, I'll probably wait until I'm 65 so that I can have Medicare pay for it, which
Well,
is poor healthcare.
That's exactly what I'm doing.
It is poor healthcare to postpone healthcare because you don't have access to the.
One thing you can do, the reason it is like it is because these other two hospitals don't have the same program as Billings does as far as doing bulk, knee replacements or whatever for everybody. But Billings is the only one that I know of that has a program. If you say you're gonna do all your knee surgeries in our facility, we're gonna give them all to you at this price. And I'm pretty sure they checked with both north and south here, and neither of them had that program. So that's why we went with that. Obviously, that's a huge money saver when we got, I don't know how many knees we're doing a year now, but a bunch. So that might be something we have to have a conversation with these two hospitals and say, we'd love to do business with you. And
Well,
Yeah,
and
that's
we have this. I mean, we do have this, and we have the voices of our people
Yeah.
in that CHA, and
Traveling back after surgery, just a nightmare.
Oh,
A
it's
hip or a
horrible.
knee.
I was thinking about having my hip done, and they don't keep you overnight for a hip. They send you home. And then you get home,
trip
and
from
let's say
hell.
I have problems and I have to go back. I mean, and all my pre-stuff is being done in Helena. I've already initiated that care. And I
Yeah,
was
that's what-
referred from my primary
So
person
that's something
here.
insurance needs to look at.
Yeah, we need to look at that for sure.
I mean, you can tell by the tone of my voice
Yeah.
that
You're passionate about
insurance
this.
determining healthcare is a pet peeve.
No doubt.
I am not, that's just, it's just not how we need to do business.
But we need to get the other hospitals to play too, we got.
Well,
hospitals
then
that-
I am passionate enough to go talk to them.
In fact, Butte was playing with them at one time,
Yeah, they
I
were.
think, and then they moved
might
to
have
Billings
changed.
instead, but it could save money, I guess, going to Billings.
And I'd be happy to talk to Dror, I mean, whatever, but,
Yeah,
this isn't good healthcare.
right.
This isn't what we're trying to do here. And that's not what our people want. And I mean, I know we're just talking about county employees with this insurance, but,
And it seemed like a conversation too, a lot of the people that had already got it done went to Billings anyway, because they do them all the time, they have the better care, they have all this stuff, and, everybody has their own preference where they go, and people they like and doctors they like, so it's.
and we should be able to choose,
Right,
honestly.
and you can, I mean.
And the other
Well-
thing that's a pet peeve for me, Corey, is I have had this health insurance for 10 years or county health insurance for 10 years. And I do not take anything out of it.
Mhm,
I am not sick. I have 360 days of sick time. I am not sick.
Sure.
I have bad hips and I'm old and I've been sitting in a chair for 4 years. So, but I'm not sick.
Yeah.
So, nothing, I'm not taking out of this pot. And when I need to,
Yeah, then you have the shortfalls.
Yeah.
I understand. We're trying to run this program as efficiently as possible. If we don't run it as efficiently as possible,
we
then
don't
you and
have it.
everybody else
I
are gonna
know.
have to pay into it because the county can't afford $2,000 a month for health insurance. So we're trying everything we can to keep the cost down, even if it's inconvenient. We know that.
Yeah,
know,
that's
so-
right.
Well, I get both sides of it, but as a healthcare provider, you're gonna hear,
Oh, yeah, no,
What?
I appreciate it, cause we did hear that side,
and
Okay.
like I said, I'll step up to the plate and tell others about my side
yeah.
if that's helpful, but,
No, and you're in with these other hospitals well enough that you can say, hey, this is why the county has to go here, because you don't provide some kind of a, you know,
An incentive for us.
for everybody to go to your hospital. If you
Right.
do, then awesome, let's get that going.
Right.
If they don't do it, then, you know, we're throwing away hundreds of
well,
thousands
like
of
I
dollars.
said, I'm more than happy to be a spokesperson.
Sure.
Because I just don't agree with what's happening there.
Yeah. I like to stay local too. Obviously, I was a businessman, and as local as we can do, I'm happy. That makes me happy. But if it's gonna save the county hundreds of thousands of dollars and keep our rates down and make our employees not have to pay into that makes it easier for us to make that type of decision.
Well, I've said my piece.
Yeah, they're shifting me to Medicare anyway, so
Are they?
they're not gonna do my knee surgery, yeah, they're,
Um,
so we're gonna save the plan about $50,000,
Yeah.
I suppose, by going to Medicare.
well, I'm doing other things and hopeful that it doesn't come to the point of having surgery, but genetically, I'm probably gonna look at it at some point in my life, cause it's kind of my family's history, but, anyway, I've got on here to talk about, community input with our strategic plan and to get, an email out to you guys with what's going on with crisis diversion.
And the resolution you talked about, you're working with Steve on that?
Well, I sent that email that had all of the people in this room on it. So, basically my request is that I have an opportunity in, an afternoon session to present on our township, what we found in the CHA and what we plan to do,
Why
you
don't you
know.
put something in there on reviewing? In a year where we're at too,
Okay.
bring it back to the board.
And then, you know, my core committee and I have talked about the possibility of having this adopted, the CHIP, the Community Health Improvement Plan, adopted as a resolution, simply to give it weight because of the work we need to do with community partners. So if the county adopts it as a resolution, it kind of gives it a little more impact and encourages people to really, and we have had a lot of interest in it. We have, I mean, the schools have been interested in it. Like I said, community integrated health has been interested in it. EMS is interested in it. Boulder Ambulance is really looking at assessing what's going on and how to improve. And that's part of what we're doing in here. So it would make some sense to pack some weight with,
And give some direction.
right? Yeah. Yeah.
We just need to figure out how to make that bridge between the program and the resolution.
Yeah.
Trick.
Steve, have I sent you copies of the community health assessment and the improvement plan? I think I put them in that
Probably.
email that I sent, but
I
I can
pretty
send,
sure I'm
Yeah.
pretty sure you did.
were they
November
on there?
20th. Yeah, I
Okay.
had to look back. It's like, you asked to be on there.
Okay, all right. So you guys do have copies. I'm gonna leave this paper one in case anybody, is like me and likes to read it and
Yes, you did.
read it in writing. I get tired of looking at a screen.
I can print them off too. It's easier on your eyes.
I can't read it on a computer, well, no.
See those people.
I like to
reading- I see
jot
those people
on it.
reading on
and,
those
you know,
Kindles.
I like to write on it and I do it in color and I highlight different.
You can do that on a
colors.
computer screen,
I
I guess, too, you know, but I don't like.
Bob, I went into nursing 40 years ago, so I never had to touch a computer. Guess what I do all the time? In fact, I gotta go get on another meeting, so, please let me know what you think about that. If you need more information from me, reach out and, if I can talk with anybody on the insurance things, I'm happy to.
Maybe, Kelly, next time we have a meeting with the insurance people, with the Boulder admin, we can invite Pam so she can be the devil's advocate, I guess, for the decisions we make. She's got a little better perspective. on a
Well,
lot of
and
the
they
healthcare
probably
stuff.
should have a copy of this too, so I'll send it.
Yeah, we'll try to put you on that list, so if you have
That would
time
be
to come
great.
sit in with our discussions about financial stuff and, you know, services, that would probably be good to have here to help balance that out a little bit,
Okay.
because we're looking at dollars, you know,
I know,
yeah,
and I'm looking at healthcare.
yeah.
I'm looking at patients. Kelly, all of us nurses had to renew our licenses this year. So I got copies of those. I will drop them off at your office. So
Perfect, thank you.
know that they're coming. All right, thank
Thank
you
you,
all.
Pam.
See you, Pam.
Bye.
I'm gonna stop recording.
Yes.
You guys are really soft. I can't hear